My name is Hassan Shuaibu Kwalam, a director in charge of primary care at Primary Care Development Agency of Jigawa State. Looking at the contribution of new incentive, I think cannot be quantified, and they have changed the landscape of routine immunization in Jigawa State. And you can see the coverage has picked up before the coming of the IB to the states. Our routine immunized in single digits, meaning fully immunized is about 7%. Now, based on the NDHIS conducted last year, the fully immunized in Jigawa State is 66%. I think this is unprecedented achievement. This is not unconnected with cash transfer or cash payment done by IB. This one motivates the caregivers to bring their children out for vaccination. And two, it also less burden the mothers and caregivers in terms of transportation costs to the vaccination side. So I think the IB has changed the immunization landscape of Jigawa State from the negative indices to the positive indices. And look at broader term, the mortality and morbidity of the disease has greatly decreased. Now we are in hot season, and you can see the temperature is about more than 41 Celsius. If there is no strong routine immunization in the state, by now our hospital and bigger PSC might have been populated by children having measles and CSM. But now you can go to any of the facilities. The burden of measles and CSM is lesser because of the penetration of routine immunization. I think for Jigawa, this is the first time we are having this meeting where you gather the 27 PSC managers to discuss issue of routine immunization in the states. This meeting is aimed at providing and giving an update to the PSC managers on the routine immunization situation in the states. And then we'll also give the state team to have an analysis what are we going to do to improve the routine immunization service across the 27 LG. Invariably, we also expect the PSC managers to have a similar meeting in their own LGA. So it's going to be a quarterly meeting whereby we'll be engaging the PSC directors so that we look at their immunization, routine immunization, what are the issues, what needs to be done to address the issue. So after this meeting, we are going to track the action point. We'll follow it one after the other so that we can get our routine immunization across. And I believe this meeting is worth it, considering the number, the participants here. We have the PSC managers, the state team members, and the people from their new incentive. So it will give us an opportunity where we rub mind, discuss routine immunization in silos, and get a common understanding of the problem with a common action point that will be implemented up to the 27 LGA. So we hope that the meeting, the quarterly meeting, as supported by IB, will be sustained, and then we have it as a platform to address some of our routine immunization challenge across the 27 LGA. Generally, I can say without any fear of contradiction that IB has done well in the states. Looking at their own coverage, the staff they are dealing with, they are very polite, with good IPC skill, and then the incentive they are giving to the mothers is very timely, without any condition. After vaccination, you just receive your money. So we want the IB to, the new incentive, keep that track of records. And the major challenge I can say is not within the system, it's within the supply chain because of frequency of stock out of vaccines. You know, by regulation, the national level is supposed to purchase the vaccines, not the states. So that's why whatever we are getting is from national level. That's why we have frequency of stock out. And then my request or my prayer to Abi. Now, in the last 3 years, we have PSC and oil, and the program has closed out first quarter this year. So as a state, we are struggling. Who will pay for the vaccine delivery from state to the LGA? Who will pay for demand generation? That involves data reconciliation between the health worker and the card life. And then equally the most important one, we don't know who will motivate the health workers with cost of one outreach. So maybe from this activity I had mentioned, the new incentive will kindly look at one area and pick, even though the state government is looking at a possibility of sustained funding. But before that one, I think I have requested the new incentive to look at it, either to shoulder responsibility of paying for outreach services or the responsibility of conveying vaccines from the LG, from the state to the LG. And then I believe they are also on to supporting the RRB meeting across the state, but I believe they can do more. So thank you so much. I think we appreciate the IB for all the good work they are doing in Jigawa State. And then we want them to stick. We are not yet matured. Yes, thank you so much.